Welcome to the Passion Perspective. This is Marie-Claire Tauvette from Relationship Bliss, and I'm so excited to have Dr. Jordan Lottman with me today, and he's going to help us with erections. I'm so excited. We're here to help men out there with erections. Dr. Lottman, how do you do that? How do you help men with erections?
All right. We use something called pulse acoustic wave therapy, as people might know it as shock wave therapy, combined with lifestyle and dietary changes. We treat the whole individual. We work with persons like yourself, with therapists and counselors. It's very important that people get everybody involved, from our treatment to our dietary recommendations, lifestyle changes, and our therapy, which over a number of years, we have really perfected our screening process, how we screen people, that they're good candidates, because most people are. People should not worry. They should know that we are able to help them. And that's how we do it. It's called pulse acoustic wave therapy, and it works beautifully. And ask away.
Yeah, so get a little bit technical with me, if you don't mind, for just a minute, and tell me, how does this machine work? How does it help men with erections?
Okay, so ED is all about not getting enough blood flow to the penis. So basically what shockwave or acoustic wave therapy is doing is twofold. Number one, we're applying it in two areas. One area naturally along the shaft of the penis, where we have an artery called the dorsal artery on the top of the shaft. We go along the shaft, and what it's doing is the sound waves are helping to dilate or open up the blood vessels to increase blood flow. And also, number two, they're getting our body stem cells to actually manufacture new blood vessels to get your blood flow back where it was 10, 20, 30 years ago.
Ooh.
The other area we work, it's very cool.
Yeah, it's so cool because you could breathe life back into the penis. And are you saying that they can really, behave the way it did many years ago? Is that
Yes.
what I'm hearing?
Yes.
Wow.
People come to us, and basically three things are happening when they're in the mild to moderate stages of ED. Number one, when a man stops waking up with erections, so they're losing their morning erection. Number two, they're getting an erection or a partial erection, but having difficulty maintaining it. So that's a big one. And so what we're doing, I'm just going to jump back to, we treat the shaft of the penis, and we also treat an area called the perineum, which is an area between the testicles and anus. Why? Two reasons. Number one, you've got a beautiful artery called the pudendal artery, which supplies the penis from that area. Remember, I talked about the dorsal arteries on top of the shaft of the penis where we work, and now I'm talking about the pudendal artery, which supplies the penis underneath. The other reason is all men, with no exception, as we age, our prostate enlarges. That's what men have to worry about, their prostate, the way women have to worry about breast examinations and screenings. So with men, it's all about the prostate. And one of the side benefits of acoustic wave therapy is we can actually, when we're working under the perineum, between the testicles and anus, we can actually help shrink the prostate. Wow. So that men are not waking up 4, 5, 6 times at night to go to the washroom. So they're not taking medications like Flomax, or another name for Flomax. The generic name is tamsulosin, but I'm digressing. The reality is we're working in these two areas, the perineum and the shaft of the penis, to do two things: dilate blood vessels, increase blood flow to the penis, and also get our body to manufacture new blood vessels, like I said, so do we get our blood flow back where it was 20, 30 years ago.
So what does the machine actually do? Does it take care of scar tissue, or how does it bring blood flow to the area?
So about 20 some odd years ago in Europe, they were finding that acoustic wave therapy or shock wave therapy or sound wave therapy was being used on knees and elbows and shoulders to increase healing, to break up scar tissue, which I'll get to in just a moment, because that's a big part of ED, is injury or scar tissue. So they were noticing that we're increasing healing, reducing scar tissue, increasing blood flow. So they said, why don't we use this technology on the male genitalia to see if we can get healing? Because a lot of people have ED simply because they've had an injury. You don't have a bone in your penis, but you certainly have lots of vasculature, blood vessels, etc. If you have an injury, if you roll over on yourself when you have an erection, if you're having intercourse, which is rough, and you hit a wall, you bend your penis, etc., you can get injury. And what happens is you build up scar tissue, plaque and scar tissue. And another term for that, that's called Peyronie's disease. So a lot of men who have ED have it because they have Peyronie's. And it's basically, if I use my finger to show, if you have an erection and then there's a blockage here, blood flow is coming to that blockage, then there's no blood flow, so the penis is flaccid. Can you see my finger okay?
Yeah, I see it
Oh, good.
perfect.
Okay.
Yeah.
So Peyronie's is a severe curve or bend in the penis. Again, it's because of scar tissue. So to answer your question, when they were figuring out that this was working because of damaged areas and knees, hips, etc., they started it on the penis and noticed that we could break up that plaque or scar tissue the same way you break up a kidney stone. So to answer your question, acoustic wave therapy, the machine has a little bullet inside which gyrates back and forth. We can set the machine to a certain bar or pressure that bullet's going to oscillate or gyrate inside the tube of the machine. And that will basically hammer away like a jackhammer and break up any plaque or scar tissue.
Oh, that sounds painful. Is it painful? Like, how painful is this whole procedure? I'm thinking, oh my gosh, a penis is so sensitive, right? It could be, what's happening with the pain of all of this?
Okay, so that's a very good question. I'm an honest person. I look at all my clients in the eye and I say, you know what? If you're not feeling it, then we're not administering it properly, because you have to apply enough pressure to get this machine in what's called therapeutic range, because you've got skin, fatty tissue, muscle, all before you get to those arteries. But it's really not that painful. I tell people it's like a 1.5 out of 5. In the perineum underneath, it's like a 0 or a 1, not bad. Along the shaft of the penis, we stay away from the head or the glands. We stay away from there because so much sensation and so many nerve endings are at the tip, the head of the penis. And I tell people it's a 1 or 2 out of 5. We give them a break every 40 or 50 seconds. It's not that uncomfortable. Nobody jumps off the table running, screaming. Everybody knows we're doing it for good reason, but I'm not a good liar. And I tell my clients, you're going to feel it. It's not bad. Everybody gets through it. We give you breaks. But honestly, it's a 1 or 2 out of 5.
That's really good. So not too painful to go
Not
through
too
this,
bad.
and you'll get a lot of benefits. What percentage of people can you help? First of all, I want to ask you, what kind of people can you help? So you've already said Peyronie's. What about people that have had cancer therapy? What about those people can you help those people? I know if they've got, I know they try really hard to save the nerve when they're doing this nerve saving. I think they use robots now mostly, right? So how successful are you after they've touched some of the nerves, or at what stage can you help them?
We do help the majority of people that come into our office, which means that I'm treating and saying yes to at least, I'd say, 85 to 90% of the people that come in, who are people that we really cannot treat, because I'd like to help the whole world.
Right.
But you brought up a very good point. For people that have had their prostate removed and there's nerve damage and they have zero sensation, zero, that's going to be very difficult. It's going to be very difficult to help somebody who has absolutely no sensation. For those people, we generally recommend that they have an old school type of therapy called a penile injection, where Muse or a pharmaceutical compound is injected, but that simply gives the person an artificial erection, and that's more for them to help their partner. So unfortunately, if somebody has full-blown nerve damage, and I'll come back to that in a second, then that's really not a good candidate. Many people have a prostatectomy or a TURP procedure, like you're saying, with the robot to remove a part of the prostate. They have a good surgeon and they don't have nerve damage, or they might have a little bit. If somebody has sensation, if they're feeling that they can get a little fuller, a very slight erection, I don't care if it doesn't last long, just something where I know blood flow's going and they have some sensation, then they're certainly a good candidate.
And
Okay.
they should go right away, right? They shouldn't wait, because the sooner they get this procedure, the higher chances they have to be successful to receive
Correct.
erections, correct?
Correct.
Right?
Correct.
So
Yep.
with time, and often I know that people that do go through this procedure, they might have erectile challenges later on, like a year later. And so trying to get, oh yeah, my erections are fine, but all of a sudden they're not so good anymore.
To get
So
the
trying
healing process sooner than later.
get
Exactly.
get the healing
Exactly.
process done sooner so that you can give it the best chance. And I would also recommend that couples out there, first of all recommend that couples do get involved. Often men will just do this alone. I've got this, I'm going to take care of this myself. But really invite your partners. As a sexual educator, I always encourage couples to do this together and make it playful. Like when you start experimenting with the erections again, make it an enjoyable process and a fun process, because if there's a psychological aspect to this too, where you need to really be in a space of play. So I would really highly
One
recommend when you
100%.
yeah
I tell my clients it's 20% up here, 80% down there. I love when clients bring in their partners or spouses. One of
yes
our one of our post-care instructions that we tell people is we're trying, especially while we're doing our therapy, for the men to get as many erections as possible. I want their partners involved. I want them playing a lot. I want the blood flow going. Very
yes
important.
get the
Very important.
ladies, massage your men. Get the blood flow going, massage them, play with them. It's really important to do that. It's play is super important. And this doesn't have to be a painful episode in your life. It could be a changing episode where you'll say, oh my gosh, this is all about play, this is about fun, let's explore, I really
And this
believe in
is about supporting your partner.
yes, it's about supporting your partner. Make it a pleasant event for them instead of a painful, stressful event. Like make it an enjoyable process and keep communicating, talk to each other. Because I think often men really want to figure this out by themselves, like I said earlier. And you know what? Talk to your partner and just go through it together. And you gave us tips when I spoke to you before, how we can really treat people holistically, because it's not just about the procedure, right? There's like food involved, like healthy eating would be important. And talk to
It's
us about
very
coffee.
important. Yeah. It's very important that they follow certain dietary and lifestyle instructions. One of the things we tell people is caffeine in high doses is what's called a vasoconstrictor. It constricts blood vessels, strangles your blood vessels. And as we age, I mean, half of men over 40 have some form of ED. Why? For
Yes.
the simple reason that as we age, our vasculature, the same way we shrink a little, so do our blood vessels. So one of the things we tell people during treatment and afterwards as a lifestyle change is to limit the amount of caffeine. Caffeine is found, and we educate them because caffeine is found in coffee, tea, dark chocolate, hot
Yes.
chocolate, pop, the dark pops, the Coca-Cola, the root beer, all that stuff. So we tell people during the 3 weeks we're treating you, we treat people twice a week for 3 weeks. I want you to eliminate or limit the amount of caffeine. I have nice gentlemen. I always laugh with them. They come in. I say, how many espresso are you having a day? Or how many cans of pop are you drinking a day? I said, at this stage of your life, after 40, with blood vessels constricting, that's not something you want to do. Everything in moderation. That's what we try to
Yes.
counsel people.
Right.
Everything in moderation.
Yeah.
So one of
And
the things, yeah, sorry.
no, I was just gonna say, like, how much coffee. I'm just thinking, like, so many people get headaches, right? Yeah. And if you're the type of person that gets headaches from not drinking coffee, you probably shouldn't be drinking coffee. I spent 2 years doing nutritional training. So yes, that out. And maybe if you are getting a bit of a headache, have a couple sips just so you can get rid of that headache, right?
Or we tell people psychologically to try decaf.
Yeah.
Decaf will still have a little bit of caffeine. And yes,
Mhm.
there is going to be some withdrawal where one of the consequences is you might get headaches for a
Yes.
couple days. But then we look at the client and we look at their spouse or partner and we say, it's worth it. It's a lifestyle
Yeah.
change.
I'm thinking it'd be good for them to start dropping coffee before they go in and start this procedure. because we want to make it a positive experience, right? So try
Well, by
slowing down
listening
the
to a
coffee.
podcast like this and people knowing, then they're prepared. But generally, when people
Yes.
are coming in for a consultation the first time, that's the first time that we're bringing up caffeine.
Right.
And
Right.
and it's very important. It is. Um, so you were asking me before about different clients that we can treat and not treat. So I fell
Yes.
off the track a little. The only other people that I have difficulty with, which we're still able to help them, is a lot of people, a lot of diabetics who have extremely high blood sugar levels need to keep that
Mm,
under control.
right.
Diabetics generally are poor healers. They have poorer circulation. And we tell people if we're going to have good success and see you over 3 weeks instead of 6 weeks or 8 weeks of treatment, you got to get your blood sugar levels under control. So caffeine's a
Yes.
big one, and blood sugar levels are very important. And people comply. They say, I don't want to walk around with this problem. And I look at people and I say, you're a young man. I mean, I treat people in their 20s and 30s, 70s and 80s, and everybody in between. And I always make
Right.
people feel that age is not a barrier to this treatment. We treat people in their 80s with high success, and younger people generally it's due to the Peyronie's or injury or plaque or scar tissue, and they don't have so much the ED, they have a blockage. And then there's
Right.
everybody else which has a combination. And I tell
Hmm.
people age is not a factor here. Blood sugar levels are important, and dietary or caffeine intake very important.
That's such good advice because if you stop eating sugar or start changing your diet, you're going to feel better overall and that's going to be good for you. It's not just your erectile challenges that are going to help you. You're going to feel great overall. And I also want to point out that if you do have erectile challenges, it's because you're probably having trouble getting blood flow to your penis, and you should probably also have your heart checked. Because if you're having, trouble getting blood to flow to your penis, maybe the blood's not flowing in and out of your heart very well. So what do you say about that?
You brought up something very good. And the reason why we discuss that with patients is patients will generally come in, and we haven't spoken about this, so I'm interrupting, but I'm going to bring up something important,
Hmm.
having had taken Viagra or Cialis or Levitra for years. Okay.
Yes.
And not everybody can take those medications. People with certain heart conditions, it's not recommended. It gets the blood flow very quickly from the head down to the penis. But more importantly, over time, those medications become less effective. Our body develops a tolerance to it. The same way you hear of the opioid crisis on the street, that doctors are handing out narcotics like they're candy, and everybody's stoned on oxycodone and Percocet, etc. So I tell people, and I guess that's where the holistic part comes in with the dietary
Yes.
changes and
Hmm.
lifestyle changes, and um, you bring up the no caffeine, the drinking lots of water, the getting the oxygenated levels in the blood higher. That's why we tell people exercise, drink
Yes.
water, cut out caffeine. I want you on as few medications as possible. If you're on medications for your prostate, we tell you get off those medications because the sound wave or acoustic wave therapy can help to naturally shrink your prostate. You should absolutely get your cardiac condition, your heart checked out, because this is all about blood flow. But even more important than your heart, again, is blood sugar levels, because that all leads to circulation. So we treat lots of people who have various heart conditions, and we have tremendous success. To me, it's all about what you put in your body, how much water, getting rid of the caffeine, and getting your blood sugar levels good. And then we check out and know which medications you're taking. So
I have
we're
yeah,
treating, sorry,
I'll
we're,
add one more thing to your list because I don't want to
please.
forget this. Sorry for interrupting you, Dr. Jordan.
Okay.
I want to add to lower your stress levels, and having sex has proven to lower your stress levels. So this is like
Brilliant.
a win, win, win. Keep
Brilliant.
your stress levels low, keep breathing, do a lot of breath work. Breathe in for 4 counts, hold your breath for 4 counts, breathe out for 4 counts. Do that several times throughout the day. Whenever you start to feel a little bit stressed, it's really going to help you to slow down and really enjoy your day more, right? And
I
you'll
agree
feel
with what
so
you're
much
saying,
better.
because if you ask a man how easy or not easy it is to get an erection when they're stressed to high heaven. And obviously, they'll tell you it's very difficult. So,
Yes.
by decreasing stress, by increasing exercise, more intimacy, more petting, more play with your partner. Believe
Yes.
me, people laugh at me when I say that because I'm sitting here counseling on how we're fixing erections, but they need to understand that having a supportive partner, a support system, lifestyle changes, and these are not serious changes. This is eliminating caffeine, eating a bit better, drinking more water, getting your blood sugar levels under control. If all men knew that all they had to do was that to increase blood flow to their penis and improve their condition, because again, I'll say it and people don't have to believe me, 50% of men over 40 have some form of ED.
That's
And
right.
and and we talk about partners and support, and that's incredibly important. So I agree with everything you're saying.
So I want to ask you, how long does this therapy last? Like they've come in for 6 sessions. That's typically what you do, right? How long will this last afterwards?
Okay.
When do they have
So
to
I
go in
tell
again?
people, okay. So I tell people that this is a permanent solution as long as you keep your lifestyle, the dietary changes, your health under control. Okay.
Right.
Um, we treat people, or the protocols that I have come up with in my clinic is we treat people twice a week for 3 weeks. And then we will follow up with people in 1 to 2 months to see how things are going. Because remember, we're dilating blood vessels, we're opening blood vessels to increase blood flow, and then we're doing the vascular regeneration part, which is the body manufacturing new blood vessels. And the research shows, and that's from the research I told you in Europe when they were treating shoulders and knees, etc., that can take anywhere from 1 to 4 months. So generally, I like to get a happy medium and say 1 to 2 months. We're going to follow up with you. We're going to see how you're doing. And if you're not at 100%, if you say, doctor, I'm at 80%, I'm getting morning erections now, my erections are lasting longer, but it's not perfect, then we can bring you in for more treatment. The nice thing about acoustic wave therapy or shock wave therapy is we really cannot damage you at all. We cannot do harm to your system by bringing you in for more treatments. So we tell people, if in a few months you find you're 70, 80% better, not everybody's the same. Everybody's wired differently. There's nothing wrong with me treating you 8 times, 10 times, 12 times. And there are some people who are lucky where 6 appointments is going to be more than sufficient for a permanent solution. But to answer your question, as long as you're not going back to having 6 coffees a day, 12 cans of pop, like Donald Trump brags, he drinks 13 cans of Coke a day. Again, that's going to cause issues. So as long as you're keeping your dietary and lifestyle changes, you have the support of your partner, then this is a permanent solution.
Yes. And I want to also bring in the partner a little bit. I want men out there to think along the lines of becoming sex gods for their wives or their girlfriends, right? I want them to also pleasure them. And this whole experience is going to be amazing. I teach men how to become sex gods in the bedroom because women have, they don't make love the same. They don't get pleasure that, just through intercourse. So if you're having a hard time through this process with your erections along the way, just if you're having a hard time, just go ahead and pleasure her for a while and then go back and see what's going to happen to your erection after. Make it a really, smooth process of lovemaking. Go back and forth. Don't get into your heads too much. And yeah, go back and forth and pleasure her. You can pleasure, she could pleasure you. And I encourage my couples, women out there, I encourage you to do a tickle his pickle night just to, play with his penis and just see what kind of different play you can have with him and make this a really enjoyable process. It's not always about penetration. It's about what you do also before he gets there, get that blood flow going in there. And it's going to just be this whole thing is going to be a super fun process. It doesn't have to be painful. It can be really enjoyable. What do you think about that,
I agree
Dr. Jordan?
100%.
Yeah.
I agree. If you love your partner, if you enjoy each other physically, if you enjoy each other emotionally, and you get pleasure from pleasuring your partner, which you should, or why on earth do you have a partner then? You must
Yes.
get pleasure when you're pleasuring your
Yeah.
partner. You're going to see results. And that's
Yes.
why I'm all about the team coming in. It's sad because really, I mean, we only have maybe 10, 15% of our clients bring in their partners, and they're leaving with instructions as, I want you to get as much blood flow as possible between appointments, as many erections as possible. And they look at me and I say, with your partner, with your friend, with your lover. I mean, this
Yes.
is all part of the process.
Yes.
Who's going to
Yes.
support you better than your partner? When I say it's 20% up here, who's going to support you better when you're going through this process? This is the same as women have changes in their body, just like men. So
Yes.
if you don't have the support of your partner and vice versa, forget it,
Yeah.
because no man's an island, and you can't just sit and masturbate all the time and watch
Yes.
pornography all the time. It's much more fulfilling through a partner.
Yeah, exactly. And if you are having trouble, please connect with me and I'll help your partner. I'll help you guys to communicate with your partners and get them involved in this process. So my name is Marie-Claire Tovette. And how can we find you? How can we make a booking with you,
Okay, so
Dr.
my
Jordan?
company is called Peak Health. We have two
Right.
locations right now, one in Toronto and one in Ottawa. If you go to peakhealthontario.com, it will show our two locations in Toronto and Ottawa, and all the information is on the website. We do a no charge consultation. I'll spend 30, 45 minutes. We'll go through your medical history. We'll hear your story, how long this has been going on, what you've been doing for it, if you've been taking Viagra, Cialis, Levitra with any success or lack thereof. We will go over your health, what medications you're on, dietary and lifestyle things that are going on. And then we do what's called an ultrasound, an audible ultrasound, to listen to blood flow in the two areas that I was talking about, along the
Oh,
shaft of the
okay.
penis
Right.
and under the testicles in an area called the perineum. But to answer your question, yes, we do a no charge consultation to make sure that you're a good candidate for our treatment, which most people are. I want to give people hope and let them know that, in conjunction with services like yours, with the dietary and lifestyle changes, and with acoustic wave therapy, they can have success, get their erections back, and a better sex life, and feel better about themselves. So we are Peak Health Ontario, and we have a location, Peak Health in Ottawa, and it's on our website, peakhealthontario.com.
So it's only a 45-minute free appointment. So why not check to see if this can help you, everybody? Peak Health Ontario. And I am Marie-Claire Tovette with Relationship Bliss. You can find me at relationshipbliss.ca. And I'm in Ottawa, but I see everybody around the world now because we're online. And I'm really loving that, actually. I'm really impressed with how this can work. But of course, you have to go in person and you have all those protocols right now all set up. So people are wearing masks in your office so they can feel perfectly safe going in to get this treatment, correct?
1,000%. My clinicians
Yes.
have masks and face shields. We're following all COVID protocols, of course. Health and safety comes number one. And yes, of course.
Okay, Dr. Jordan, I really want to thank you for the work you're doing to help men. My heart goes out to all those men that are having erectile challenges, and please do connect with Dr. Jordan and his clinic. And you guys are gonna be so happy. You're gonna be like in a good mood, bouncing around. You'll be more creative. You'll do better work. You'll be, it's just a way for you to have an amazing lifestyle, and that's what I want for all of you out there. Take care, everybody. Thank you so much for being our guest, Dr. Jordan. It was a pleasure to speak to you today.
It was a pleasure. Thank you.
Take care. Bye.
Bye bye.